All right, Patrick, now another very popular wrinkle remover, the muscle relaxant drug, Botox. Millions of people have used it, assuming it's safe. But the question is it? Tonight, one woman says she learned the hard way. Our chief medical editor, Dr. Bruce Hensel, has a special report and some advice.
My face was completely paralyzed. Could not move anything.
Debbie Sosley says that's the result of Botox injections into the lines between her nose and mouth. Botox works by poisoning the nerves that control muscle movement. Her doctor assured her the effect would wear off in a few months. Nearly 3 years and 2 operations later, she says she still feels the effects.
My cheeks, which I used to have cheek pads right here, are now completely flat. All in through my mouth area has dropped considerably. It's like a drag, kind of a droopy look and feeling.
Debbie's doctor did not return our calls. A spokesperson from Allergan, the maker of Botox, said, "We've not had any experiences or reports where people had a persistent effect that doesn't have another basis for it."
Where Debbie got injected, they injected these muscles right here.
Dr. Rex Yanis did brow and eyelid surgery on Debbie.
She definitely had some problems in the lower eyelids and here, but I couldn't say that it was from the Botox. Her forehead's all done.
Plastic surgeon Brent Moelleken has given thousands of Botox injections.
There have been no reported cases of permanent paralysis from Botox because it just works very temporarily. But sometimes, you know, if you do 1 million injections of anything, you may get some lightning striking through the window.
Moelleken says there may be another explanation for Debbie's symptoms.
If someone had an underlying disease of the nervous system, it's possible that that disease could have been unmasked. In other words, that we just found out about it because of the Botox.
Now, although there's no absolute proof that Botox's effects can be permanent, you do need to know about potential side effects. One is a mild allergic reaction. Another is infection at the injection site. The third is called tracking.
The Botox would track, we call it tracking, where it kind of oozes over to an area where we don't want it to be.
Moelleken says you can avoid that by keeping still for a few hours after the injections. Debbie says she did that, but she still experienced tracking. Here she is before Botox. 10 days later, her entire face appears affected, even though she only got the Botox in her nasolabial lines. Yanis says we don't have enough studies to predict the effect of Botox there.
Well, I think that's something that most people stay away from. It's not. It's tricky, in that you can get good results and bad results.
Let go!
Is that what happened to Debbie? Did she have a permanent side effect that studies have yet to uncover? Or did Botox unmask an underlying problem? We clearly need more research to answer those questions. Dr. Bruce Hensel, Channel 4 News.
Well, the best wrinkle fighter of all, of course, is staying out of the sun. Hasn't been too much of a problem lately, has it?
Wish we'd known that a while ago.
Yeah, maybe.